Thanks, Sailor. Thanks, Michelle. I did speak to Sailor and Michelle just before they were leaving hospital. What a brave story. What an important story. I think Sailor will do more for adolescents and young adults in terms of a vaccination message than I'll ever do, even with a couple of hundred visits to this podium, because it's a real story, and it's an emotional story because these are lives completely upended by this virus, and the powerful reflections on what a difference vaccination makes is the key message that I would like to reinforce as well. Obviously, Sailor wasn't eligible for the vaccine at the time that she contracted COVID. That's reflected in everything we're seeing with this epidemic. It's reflected in everything we're seeing in hospital at the moment. So, of cases in hospital yesterday, 91% not fully vaccinated. Of those in ICU, the most unwell patients like Sailor was last month, 98% not fully vaccinated. So if you are fully vaccinated, you are effectively not allowing yourself to be in a position where you need ICU. All three vaccines now with Moderna in Australia, very effective, very safe, and will keep you out of ICU. So if you're one of those people who haven't yet thought about getting vaccinated, as Sailor says and as Michelle says, it's your choice. But who wouldn't advocate, as I have done tirelessly, for vaccines, knowing what a difference they can make in people's lives for all of us, and to get out of this damn lockdown. In terms of our current cases, about a third are in the northern suburbs, just over a quarter in the western suburbs, about a quarter in the southeastern suburbs, and 5% in the eastern suburbs, and just over 8% reasonably stable in regional Victoria. But we have seen more cases, including some increased cases in Baw Baw, Greater Geelong, Greater Shepparton and Mildura. We've also seen a handful of cases in Swan Hill, very likely linked to Mildura. So we're asking everyone in Swan Hill, as we do everyone everywhere, be alert to symptoms and get tested if you have any symptoms. There's still very good testing going on in Mildura, so picking up those cases, which is fantastic. We do have a new mass testing site in Cranbourne that I mentioned yesterday. Did more than 1,100 tests, so it's good to see numbers rising there. There's still capacity for more people to come through. And then on vaccination, further to the Minister's announcement, there are some other pop-ups that have continued to have great success. The Islamic Centre in Newport, in its final week, just going through the second doses now, it's done more than 11,000 shots since it opened a month ago. It's been one of our most successful pop-up sites, really with in-language and culturally appropriate support to the diverse community in Newport and Hobsons Bay. And, we've spoken of the increase in vaccination coverage in those areas. It's really been very significant, and in no small part to that kind of engagement and provision of vaccines. So well done, and thanks from all of us. And we wish you well in your final days of being a pop-up site. Palm Plaza Dandenong's also done nearly 15,000 doses in under a month. That site's providing both Pfizer and Moderna, also accepting walk-ups. And it's really important. Dandenong's still behind the state average for both first and second doses, but again, really huge uptick recently, but still only at 81% first dose and 50% second dose. That's not enough to drive numbers down properly, so we encourage anyone of any age to come down and get your vaccine there, especially if you haven't started your course. And really for anyone across Victoria, if you've started your course, if your second dose is due, and some people, may have had changes to their booking schedule or kind of missed out as the interval has changed in terms of recommendation, please follow up with your second dose. Again, that's a reflection from Michelle and Sailor. One dose, good protection in terms of severity of illness, but those two doses really, really strong protection, 95, 97 plus % protection against dying, against being in ICU. So please finish your course if you've had that first dose and you're due for your second one. Even if you're late now, never too late for your second course to complete that dose. Finally, one of our school pop-ups, Brunswick Secondary College, did almost 1,000 doses over the weekend. Well done there. More than a third of attendees born overseas there. And now, as the Minister said, we're bringing mini pop-up sites to local shopping strips and cafes. So there'll be much more ready access. So keep an eye out for things in your local area. It's never been easier to get the vaccine. It's probably never been more important. So if you haven't already, please step up, get vaccinated. Thank you. No, the Minister's absolutely right. They're all very, very protective against hospitalisation, ICU and dying. And they've got their own uncertainty range in that regard, but they're in the high 90s for all 3 vaccines that are available in Australia. And again, the one you should get is the one that's available for you now. I got AstraZeneca. Some of my family members got AstraZeneca and Pfizer when... with Moderna available, whatever the booster shots might be, I'll be stepping up for whatever booster shots available. If Novavax is part of a booster system and that's the one offered to me, I'll step up for that. I think we rightly trust the TGA. It's got a very cautious, appropriately conservative approach to the regulation of all new medicines, including vaccines, and they take their time to look through all of the available data. They've got a really rich data set that's provided by the pharmaceutical companies in those assessments, and looking at the international evidence on effectiveness and safety from across the world. So when it comes to us as a recommended vaccine from ATAGI, it gives me absolute confidence that it's an appropriate one for any of us to take as recommended by ATAGI. So just step up and get the vaccine that's there for you.
Do you know much about those Embracia patients?
I understood that they were all fully vaccinated. So the issue is there's a real reduction in the risk of transmission when you're vaccinated, but it's nowhere near 100%. It's more like 60%. So you can become positive, you can transmit to others. That's what's happening in these aged care facilities. They need to take all of those other measures that we have really embedded, the use of PPE, the cohorting, the ventilation and all of the infection prevention and control measures that need to take place. But there are challenges with wandering in those settings. There are challenges with some very infectious individuals with coughing. So, that becomes difficult to manage, but it does, again, really reduce the risk of very severe illness for those individuals. But some of those aged care facilities got the vaccine very early on, February, March. So, again, we're all keen to hear advice nationally on the booster recommendations and those arrangements, and to roll that out as soon as possible. And I can imagine that aged care facilities, whether they're targeted as a high priority as aged care facilities, or whether they're just rolling through because it's been 5, 6 or more months for some of those, I think they'll be first in the queue to get that additional protection. Some of the evidence on booster doses is really, really encouraging, including that you've got 10 times the kind of immunity indicators with that booster dose. That is really positive news. And I think the Chief Medical Officer, Paul Kelly, or Brendan Murphy have spoken of the fact that the booster might be enough for a long time thereafter. Who knows if it's for life, but it'll be, potentially years after that booster dose that you've got that protection, and maybe do not need regular boosters, 6 to 12 monthly. That would be a terrific finding to come to as well.
On reopening, Brett, we're getting up towards that 90% first dose for 16 and above. Next one after that, next goal would be 90% for 12 and above. I guess how many more freedoms do you envision us being able to have when we get to that 90% 12 and above? And are you expecting to kind of release a new stage of the roadmap on what might be available, which I guess might act as an incentive for people as well?
Yeah, of course. I think we have to consider that. I fully expect that we can go further as we get higher vaccination coverage, whether that's 90% 12 and above, or whether it's 85% double dose. they're reasonable considerations to make with regard to further easing. Of course, we need to look at the international landscape there, how those highly vaccinated countries like Portugal and Spain and Ireland and Denmark and Iceland are doing, and by and large they're doing very well, and they've opened up even further as they've gotten to those very high levels. But we also need to see what challenges might be ahead, even at those high vaccination coverage rates, because Singapore's had 3,500 cases a day with a very highly vaccinated population. They've got something like 40 people in ICU. So, with a similar population to Victoria, a much lower level of ICU admissions with that very high double-dose vaccination coverage. So you can have high numbers of cases and protect your health system and protect people's health and well-being. So we just need to look at all of that evidence as we progress to those thresholds. But I fully expect we can and should go further with higher and higher coverage, which is, yet another reason to talk about everyone coming forward to get vaccinated and getting that second dose.
Professor, can I get you to reflect on today's numbers? I know yesterday you said you were taking a cautiously optimistic approach. We saw a 5-day low. Numbers have picked up slightly, but significant deaths obviously recorded. So how many days do we need to track to see how we can...
Look, another couple of days, and I think I'd be extremely confident that we're on the downslope. We're probably on a plateau at the moment. Even though today's numbers are a little bit more than yesterday, it's well below the peak of 1,900 plus cases that we've seen previously. So I think, we're very likely to be headed down from here, but it'll be a bit of a bumpy numbers ride day to day. On deaths, as the minister's reflected, we see people who relapse, people who develop their severe illness a week, 2 weeks after they've been confirmed with COVID. So we will unfortunately see days of significant deaths. I'm also, pleased that we've seen a lower relative hospitalisation rate and ICU occupancy compared to New South Wales with similar cumulative confirmed cases. Good vaccination coverage of those most at-risk age groups. So 70-plus age group getting to the 95% first dose coverage is huge protection from hospitalisation.
Would you be comfortable to reopen with the current caseloads if they do continue to decline?
Yeah, I think we're on track for that reopening, absolutely.
Schools, Brett, how many schools at the moment are affected by COVID outbreaks or isolation? And secondly, have you got any more fine-tuning on that isolation policy for students and teachers? We were talking about that last week, I think.
Yeah, we have. We'll have more to say on it probably tomorrow. There have been over 30 exposures in schools. The data on transmission will come through over today and tomorrow and the next day. So a lot of those exposures, you don't know whether they've led to further cases because there's an incubation period, an average incubation period of 4 to 6 days before new cases might emerge. That'll be really important data for us to see what the effect of vaccination is for some of those students, what the effect of both the case and a contact wearing a mask. I suspect it'll really substantially reduce transmission, and it'll mean that we can have some confidence about kids carrying on in school with their exams, with their studies, without needing to be super conservative about what our close contact definitions are. But there is some more data to come through on that through today and tomorrow.
I don't know whether this would be one for you or for the Minister, but websites are popping up that are offering people fake vaccination certificates. You can pay a bit of money. Apparently it takes a few minutes for them to come up. Is that a concern for you, and what can be done against those, I suppose?
Of course it's a concern for me. We know that there are some highly motivated individuals who are trying to get around the system. They are a very small minority. Our behavioural survey data suggests that it's 4% or fewer people who currently say they wouldn't get the COVID vaccine. To me, that says there are 96% of people who have already declared that they're going to get it or are very close to coming to that determination. So those very small percentages of people won't change the landscape substantially, but they've found some very creative ways to try. I think equally our department, working with Service Victoria, are being very clever about how those certificates are going to be validated and not able to be counterfeited, but the Minister might have more to say on that.
We reopen of every Victorian eventually catching COVID?
Look, it's difficult to say. Obviously, we're going to do everything we can to protect those who are not eligible yet for a vaccine, and some who won't be eligible in the longer term. So, there are good prospects for the TGA approving a vaccine for kids 5 to 11 years of age, maybe before the end of the year. That's not a certainty. As I said, the TGA will be cautious, conservative, very considered in that assessment. I'm not jumping to the conclusion that they'll approve a vaccine for that age group, but people who are not vaccinated, eventually everyone will get it. So, for the very young kids, we know that it's overwhelmingly mild disease. But, as Saylor demonstrated, there are adolescents, there are other teenagers who can get really significant illness. There have been 300 or more deaths in the US in adolescents and other kids. So, it's not a nothing illness for anyone. And I think over the course of another year, another 2 years, absolutely everyone will get it as we open up, because we're not going to hold back in terms of how we live our lives and move around when we're a fully vaccinated population, the fullest vaccinated population we can be. That means that there'll be really widespread transmission of this very infectious virus.
Sorry, you mentioned Baw Shire as a new hotspot. I think there's about 100 active cases there. Why have they not been sent into lockdown, and what's the trigger, considering it doesn't seem to be based on infections alone anymore?
Look, they had a big spike a couple of days ago with 31 cases in a day. It was known what the super spreading event was there. It was, household gatherings, and those households have then had subsequent cases, but they are largely linked. They are largely being identified in people who've been identified as primary close contacts and can quarantine. So we'll keep an eye on it, but it's more of a known entity. And from that very high number a couple of days ago, it's kind of trended down. Again, yesterday a bigger number, but mostly linked and mostly quarantining. But we'll keep an eye on it. Part of our considerations are how community health services, local health services are able to respond to that caseload and manage with the local public health unit support. But at the moment, it's relatively stable, and they will push on, as have lots of regional local government areas, to higher and higher vaccination coverage, which kind of stabilises the prospect of a really explosive outbreak.
Last question.
Do we know how many cases in Mildura and Swan Hill since yesterday as well?
I think 24 in Mildura since yesterday, but Jerome went up there. There's good coordination, there's lots of support. I think they feel like it's getting under control. But again, still some work to do with vaccination coverage there. They've got good vaccination coverage, but for priority populations, including Indigenous Victorians in Mildura, still some work to be done. That's cracking on, and there's really good cooperation with the Victorian Aboriginal community-controlled health organisations there.
Professor, we obviously know about the NICU unit outbreak today, the Kookaburra ward, which was oncology 2 weeks ago, and the hospital's revealed that 3 other wards have also had exposures. How concerning is this?
Yeah, look, no one wants exposures in really vulnerable settings. I think, as the Minister said, those health services do everything they can. People wear appropriate PPE, so an exposure doesn't necessarily mean transmission at all. And of course, they can set the visitor restrictions accordingly. They're free to do that. We've got a kind of minimum set through the public health directions, but they can make them more stringent if they feel a requirement to do so. And indeed, as the Minister's referenced, use rapid antigen testing as they see fit, as many emergency departments do, as lots of other wards do. So, I think it's being managed very well, but the risk remains as long as we haven't got super high vaccination coverage. Thanks all.
Thanks.